हाँ जी वैलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल ਦੇ ਉੱਤੇ। सो ਜਿਹੜਾ ਆਪਾਂ ਬਾਬਾ ਫਰੀਦ ਦਾ ਐਗਜ਼ਾਮ ਹੋਇਆ ਸੀ 2021 ਦੇ ਵਿੱਚ ਉਹ ਆਪਾਂ ਡਿਸਕਸ ਕਰ ਰਹੇ ਸੀ, ਉਹਨਾਂ ਦੇ ਆਨਸਰਸ ਨੇ। ਸੋ ਉਹਦਾ ਪਾਰਟ ਸੈਕੰਡ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ। 40 ਕੁਐਸਚਨ ਤੱਕ ਆਪਾਂ ਕਰ ਲਏ ਸੀ। 41 ਕੁਐਸਚਨ 41th ਦੇ ਵਿੱਚ ਹੈਗਾ ਦਾ ਨਰਸ ਇਜ਼ ਪਲੈਨਿੰਗ ਦਾ ਕੇਅਰ ਆਫ ਅ ਕਲਾਇੰਟ ਡਾਇਗਨੋਸਡ ਵਿਦ ਅਕਿਊਟ ਗੈਸਟਰੋਐਂਟਰਾਈਟਸ। ਸੋ ਵਿਚ ਨਰਸਿੰਗ ਪ੍ਰੋਬਲਮ ਇਜ਼ ਪ੍ਰਾਇਓਰਿਟੀ। ਆਪਸ਼ਨਸ ਨੇ ਇੰਪੇਅਰਡ ਬॉडी ਇਮੇਜ, B self care deficit, C fluid and electrolyte imbalance, D imbalanced nutrition। सो नर्स केयर कर रही है, पेशेंट हैगा अक्यूट गैस्ट्रोएंटराइटिस का। सो किहड़ी नर्सिंग प्रायोरिटी बनूगी इहदे विच? फस्ट ते की ओह करूगी नर्स इन्हां विचों असैस फ्लूइड एंड इलैक्ट्रोलाइट इंबैलेंस। सो ऑप्शन नंबर C इज द राइट आंसर होगा। नैक्सट हैगा क्वेश्चन नंबर 42। अ क्लाइंट वॉज एडमिटेड टू अ साइकैट्रिक यूनिट विद अ मेजर डिप्रैशन आफ्टर अ सुसाइड अटैम्प्ट इन एडिशन टू फीलिंग सैड एंड होपलेस। सो नर्स assess which of the following: anxiety, unconscious anger and hostility, B guilt, indecisiveness, poor self concept, C meticulous attention to grooming and hygiene, and last option is psychomotor retardation or agitation। So right answer is guilt, indecisiveness, poor self concept। So 42 the option number B is the right answer। 43 protein catabolism can yield which of the following: complex carbohydrates, glucose, free fatty acids and omega-3 acids। So right answer is option number A, complex carbohydrates। Next 44th, while reviewing the causes of gastroesophageal reflux disease with the patient, so what area of GIT tract should the nurse identify cause of reduced pressure associated with gastroesophageal reflux disease? A pressure in the stomach, B lower esophageal sphincter, C pyloric sphincter and D duodenal pressure। so ਇਹਦਾ right answer ਕੀ ਹੋਊਗਾ? option number B, lower esophageal sphincter। next हैगा 45th question। A patient is experiencing confusion in the immediate postoperative period। So which of the following assessment to determine reason for the confusion: airway status, cardiac rhythm, level of consciousness, level of anxiety। so ਇਹਦਾ right answer ਕੀ ਹੋਊਗਾ? level of consciousness check करना। so option C is the right answer। 46th हैगा question number 46th। The wife of a patient with paranoid personality asked the nurse why the patient keeps blaming her for plotting against him. Which of the following is the appropriate response by the nurse? A patient with paranoid personality disorder suspect other motives. Patient with paranoid personality disorder prefer solitary activities. C patient with paranoid personality disorder lack interest or hobbies. Patient with paranoid personality disorder is emotionally detached। so 46 the right answer की होगा? option D, patient with paranoid personality disorder is emotionally detached। 47th, the following are the modes of transmission, modes of horizontal transmission of disease accept। so A contact, B vector, C common vehicle, D genetic। so the right answer is 47th the right answer की हो? option D, genetic। 48th, which ethical principle is most applicable to the highly publicized issue of universal health care: justice, autonomy, non-maleficence and beneficence। so the right answer is option D, beneficence। 49th, a 26-week gestation woman is diagnosed with severe preeclampsia with the HELLP syndrome। so nurse will assess for which of the following sign and symptom: high serum protein, bloody stool, low serum creatinine and epigastric pain। so the right answer is option number B, blood stools, bloody stools are the right answer। 50, a client with history of Graves, disease, admitted for uncontrolled hyperglycemia and a foot ulcer. So this client require close monitoring because of increased risk of which of the following symptom? Select all that apply. A. Hypoglycemia, B. Hypothyroidism, C. Hypotension, D. Extreme tachycardia, elevated temperature. So the right answer is option number C. A, B, C, D and E are the right answers. Next हैगा 51 question. The nurse is admitting a child suspected of having hyperglycemia. So which of the following assessment finding would support a diagnosis of hyperglycemia? Select all that apply. So the right answer is blurred vision, hunger, pallor, polydipsia, tachycardia and headaches. So the right answer is A, B, C, D and F. So option C is the right answer. 52. The client is experiencing severe diarrhea and serum potassium level 3.3, and which intervention should the nurse implement first? Notify the client doctor, prepare the administer intravenous potassium, place the client on cardiac telemetry, assess the client for leg cramps. So the right answer is की हो गया the right answer? Option number C. Place the client on cardiac telemetry monitor. 53. A client dying suicidal ideation comes into emergency department complaining about insomnia, irritability, anorexia and depressed mood. So which intervention would the nurse implement first? So the right answer is remove all hazardous material from the environment. So option D is the correct answer. 54th, an 8-year-old client diagnosed with vaso-occlusive sickle cell crisis is complaining for severe headache. So which intervention should the nurse implement first? A. Assess the client neurological status, administer a narcotic, analgesic via intravenous, administer 6 liters of oxygen via nasal cannula and increase the client intravenous rate. So answer is administer a narcotic analgesic by intravenous push. 55. The nurse is assessing Bishop score on the post-date client. So which of the following measurement will the nurse assess? Cervical dilation, fetal station, cervical position, rupture of membranes, gestational age. So the right answer is option number A. A, C, D and E. A, C, D and E. Cervical dilation, cervical position, rupture of membrane, gestational age are the answers. Next हैगा 56th. In assessing a child thyroid status, which of the following assessment findings should be documented as subjective finding? Fatigue, weight loss, hypertension, tachycardia. So fatigue is a subjective finding. 57th. For a patient who underwent thyroidectomy 2 days ago, so which laboratory value require close monitoring? Potassium level, calcium level, white blood cell count and last is sodium level. So the right answer is option number B, calcium level. Option B is the right answer. 58. Which symptom experienced by a client diagnosis with schizophrenia would predict a less positive prognosis? Hearing hostile voices, having little or no interest in work or social activities, continuously repeating who has been said, thinking that TV is controlling his or her behavior. So having little or no interest in work or social activities. Option B. 59th. Patient with sinusitis is going home with an antibiotic prescription. So discharge teaching will include go to the emergency department immediately if any headache occur, breathe in cool air via humidifier after 2 hours, use decongestant and antihistamine, and follow fluid restriction guidelines. So the right answer is go to the emergency department immediately if any headaches occur. So option A is the right answer. Next है 60. An important role of nurse is to facilitate social interaction between patient who is paranoid and the patient peers. Nurse implement this intervention based on the understanding that is patient with paranoid personality disorder is gregarious in socialization style, tends to exhibit loose boundaries when sharing, feeling likes to be round large group of people, tends to be isolated and lacks social skills. So the right answer is tends to be isolated and lacks social skills. Option D is the right answer. 61. Patient becomes angry and aggressive towards the nurse after speaking on the phone with his mother. So student nurse recognize which coping mechanism? Displacement, transference, projection and substitution. So the right answer is displacement. A is the right answer. Next, nursing may be identify diagnosis and treatment of human responses to health and illness. So this definition nursing was given by Nightingale, American Nurse Association, Henderson, World Health Organization. So the right answer is American Nurses Association. Option B is the correct answer. Next हैगा question number 63. A pregnant woman who is hospitalized of treatment of pregnancy induced hypertension in the third trimester. She is receiving a magnesium sulfate intravenously. So nurse understand that medication is used to mainly which medicine used to mainly. So the right answer is prevent convulsion seizures. Option A is the right answer. 64. Client is scheduled orchistomy. Which of the following procedures support the term orchistomy? Partial surgical removal of the penis and dissection of related lymph nodes, surgical removal of entire scrotum, surgical removal of testicles. So right answer is surgical removal of testicles is known as orchistomy. So option D is the right answer. 65. Which of the following will be abnormal in a child with the diagnosis of hemophilia? So platelet count, white blood cell count, hemoglobin level, partial thromboplastin time. So the right answer is partial thromboplastin time. 66. Patient is admitted to a medical unit with possible Graves' disease. Which assessment findings support this diagnosis? Bradycardia, periorbital edema, exophthalmos, hoarse voice. So the right answer is exophthalmos. Option C. 67. Client has been receiving lithium for the past 2 weeks of treatment of bipolar illness. When planning client teaching, the nurse understands that it is important to emphasize the client must restrict the. So which answer is client has been receiving lithium for the past 2 weeks of treatment of bipolar disease and maintain a sodium diet, come in for evaluation of serum lithium level every 1 to 3 months. So take a diuretic with the lithium and have blood lithium level drawn during the summer. So इधर right answer की होगा? इधर right answer होगा option A, maintain a sodium diet. Next हैगा 68. The nurse recognize Disney as which of the following? Increased awareness of respiratory effort, decreased alveolar ventilation, decreased rate and depth of respiration, and decreased oxygen saturation of venous blood. So right answer is decreased awareness of respiratory tract. 69. When planning the care of patient who is paranoid, the nurse should which of the following intervention to increase sense of trust? A. Give the patient nurse home number for support, spend more time with his patient than others, solicit the patient participation in the development of treatment plan, fulfill all the patient request to provide assure of active listening. So option D is the right answer. Next हैगा 17th. Following are the measures of central tendency except mean, median, mode, variance. So the right answer is variance. 71. A newly admitted client with a long history of alcoholism complained burning and tingling sensation of the feet. So nurse would recognize this symptom as indication of which condition? So the right answer is peripheral neuropathy. Option D is the right answer. 72. The nurse is assessing the laboratory report of 40-week gestational client. Which of the following values nurse accept to find elevated above pre-pregnancy level? Hematocrit, bilirubin, glucose, fibrinogen. So the right answer is fibrinogen. 73. Which of the following finding on a female breast exam should the nurse suspicious of breast cancer? A. Poorly defined firm lump that is non-tender fixed to the skin. Second, soft mobile single lobular nodule that is non-tender. Multiple bilateral round lumpy tissue that is tender. And last is single soft lump that is well defined and tender. So the right answer is multiple bilateral round lumpy tissue that is tender. So right answer is C. 74. Nurses caring for a newborn with neural tube defect, the best covering for lesion is A. Moist sterile non-adherent dressing, dry sterile dressing, Telfa dressing with antibiotic ointment, sterile occlusive pressure dressing. So the right answer is option number B. Sorry, 74. The nurse ਦੀ केयर कर रही है न्यूबॉर्न बेबी ਦੀ न्यूरल ट्यूब डिफेक्ट ਆ सो बेस्ट कवरिंग लीजन ਦਾ ਮੈਥਡ ਕਿਹੜਾ ਹੋਊਗਾ ਮੋਇਸਟ ਸਟਰਾਈਲ ਨਾਨ ਹੈਡਰੈਂਟ ਡਰੈਸਿੰਗ ਹੋਊਗਾ 75 ਮੇਲ ਕਲਾਇੰਟ ਡਾਇਗਨੋਸਡ ਵਿਦ ਰੈਨਲ ਕੈਲਕੁਲਾਈ the patient is admitted to a medical unit. Which intervention should the nurse implement first? Assess the client pain, request the client to urinate a urinal, strain a client urine, increase the client to oral fluid intake. So ਇਹਦੇ ਵਿੱਚ right answer ਕੀ ਹੋਊਗਾ 75 ਦਾ A. assess ਕਰੂਗੀ ਸਭ ਤੋਂ ਪਹਿਲਾਂ client ਦੀ pain assess ਕਰਨੀ ਆਪਾਂ 76 nurse is talking with the client. Patient abruptly says to the nurse, moon is full, astronauts walk on the moon, walking is a good health habit. The client behavior most likely indicate which of the following? Neologism, word salad, dissociation, flight of ideas. So right answer is A. 77 which statement best describe the metabolic function of the liver? Detoxification of endogenous and exogenous, and fluid volume control and acid base balance, erythrocyte and leukocyte breakdown, concentration and storage of bile. सो इन्हां चों आपां बेस्ट स्टेटमेंट किहड़ी है जिहड़ी मैटाबॉलिक फंक्शन ऑफ द लीवर दे नाल डिस्क्राइब करदी आ ਇਹ ਤੁਸੀਂ ਕਮੈਂਟ ਸੈਕਸ਼ਨ ਦੇ ਵਿੱਚ ਦੱਸਣਾ। ਸੋ ਬਾਕੀ ਜਿਹੜੇ ਰਹਿ ਗਏ ਕੁਐਸਚਨ ਉਹ ਆਪਾਂ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ ਕਰਾਂਗੇ। ਓਕੇ, ਥੈਂਕ ਯੂ।